Good day, everyone, and welcome to our session today. Sharing session. May do have interpretation services, and so please keep to a channel of your choice, and please join the discussions through the chat. Questions, comments, and counter responses are through the chat. My name is Francis Ochen, a project manager at ASLM. I am your moderator today. Today, we focus on options for handling molecular liquid waste containing guanidine thiocyanate. Really focusing on results from a pilot study and implementation from Uganda and Nigeria, respectively. We know that there's been a considerable increase in demand for and delivery of lab services over the past decade or so. And this heightened demand for lab services proportionately increases supplies needs and also subsequent wastes that get generated, including molecular liquid waste that contain a GTC. And whereas we know that GTC is toxic to humans, animals, and the ecosystem in general, if not properly handled and disposed of, there are advanced oxidation approaches through either ozonation, hydrogen peroxide treatment, incineration, and many other approaches that are known to really render the cyanide in the GTC non-hazardous. And so in this session, we'll look at the use of hydrogen peroxide and ultraviolet light in the treatment of liquid waste from molecular labs, and also running a centralized incineration facility for molecular liquid waste, focusing again on the experiences from Uganda and Nigeria. And to take us through this, we have two presenters. Our first presenter is going to be Mr. Joel Opio. Joel Peter Opio is a public health specialist with the US Center for Disease Control and Prevention in Uganda. And Joel oversees the lab biosafety and biosecurity portfolio. He has also been with CDC for over 15 years now, primarily focusing on strengthening health systems in the lab sector. And he has also significantly contributed to the Uganda's lab sector, including improving the lab hub infrastructure, the famous lab hub infrastructure in Uganda. He has also led multiple labs into ISO accreditation across the country. And Joel serves too as the chair of the Uganda Virus Research Institute Biosafety and Biosecurity Committee. He is also currently the National Biorisk Subcommittee member at the Ministry of Health in Uganda. And last but not least, he is a certified member with IFBA for biosafety professionals globally. Then our second presenter is going to be Dr. Ugwerugene Kingston Omo Emmanuel. And Kingston is a clinical lab program manager with USAID Nigeria. Kingston is involved in strengthening national lab practices and systems. He supports implementation of quality management systems and also preparing labs, taking them to accreditation. His experience includes supporting lab workforce development. He's also done a lot in increasing really lab testing capacity through the lab network optimization, equipment placement, and lab commodities procurement and distribution in Nigeria. He's also supported a lot of work in ensuring that the National Sample Referral Network for Nigeria works the way it is working currently. And he is also supporting a lot of work in biorisk management, including laboratory waste management. Before joining USAID, Kingston worked with the Family Health International in Nigeria, among other entities therein. And so colleagues, join me in welcoming our two presenters, starting with Joel Opio, and then we'll get to Kingston. Joel, over to you.
Thank you very much, Francis, for such a wonderful introduction and for giving me the opportunity. My name is Joel Peter Opio. I work with CDC Uganda as reduced in the lab system branch. And I'm happy to share with you Uganda experience in the use of hydrogen peroxide and UV light to degrade guanidine thiocyanate, what we normally refer as GTC, in viral load and EID liquid waste management. So my presentation headline is, as you can see, I'm going to talk briefly about the national guiding documents that we have in the country for waste management. Then I will take you through briefly on the lab network, then talk about the Central Public Health Laboratory, which of course is the reference lab that is doing centralized viral load and EID testing. Then a brief touch on the testing volume and the waste burden that we have in the country, and finally end up with the new innovation that we are working on as a country. So starting off with the national guiding document that we have. One, we have the National Policy for Healthcare Waste Management, which was established or first developed in 2004, but currently under review by the Minister of Health. And one of the policy objectives actually captures that liquid chemical waste and potential wastewater from isolation wards are treated separately. And also another document that talks about liquid waste management is the National Implementation Guidelines for Healthcare Waste Management. And in it, actually, there's a component that talks about effluent, particularly effluent from isolation wards and medical laboratories that should be considered hazardous and should be treated in a specific way. But most important to note that this document do not provide specific procedures for treatment of GTC in liquid waste. The slide you are seeing actually gives you insight on our laboratory network. On the left is the map showing the national lab network, indicating how specimens are transported and results are returned from the different laboratory hubs across the country to the centralized testing point at the CPHL found in the southern part of Uganda. And on the right is an illustration of how movements or samples are made from the facility through motorbikes to the hubs, which are mini centers of excellences within the countryside, and how they move by vehicle to the viral load testing at the CPHL. And that is a picture just showing the central lab where it's located, which is about 10 kilometers away from the city center. The lab is comprising of about 5 laboratories, and one of them is the National Viral Load and EID, including HIV Drug Resistance Laboratory, and it's accredited to ISO 15189. And another one is the National Microbiology Lab, also accredited to the same standard. Then, of course, there's the National Equipment Calibration Laboratory, which some of you were here last week heard about. It's accredited to 17025 accreditation standard. Then there are others like the sickle cell and malaria lab, the PT panel production lab, and the National Biorepository. But important to note here is that all this lab generates about 1,000 kilograms of solid waste, not liquid, on a daily basis. And that shows you the magnitude that we have. So looking at the testing volume, these tests actually are produced by about 12 equipment. We have the Cobas, the Roche Cobas 8800, which are 2 of them. About Alinity are 7, then Hologic are 3. And all these platforms produce over 1.5 million viral load and EID tests annually. And on the right, you can see an example in 2022 and 2023, where the viral load test actually was over 400,000 and EID was over 50,000. And of course, that shows you with that magnitude of volume, the amount of waste that is really generated, both liquid and solid. To give you the snapshot of the waste burden, the increase or the scale up of viral load and EID testing following WHO guidelines in 2018 actually caused the increase in the waste generation, which actually came to between 12 to 20 tons per month. Of course, when you look at 1,000 kilograms per day, that is the range for sure. But the liquid waste actually has been sorted out. The challenge has been sorted out with the support from PETFA. The ministry was able to acquire a high capacity and high temperature incinerator that was able to absorb all that volume, those quantities. And as I talk now, the problem of liquid waste has been sorted because it's managed from site. But when it comes to liquid waste, the production for the entire reference lab that you saw is about 100,000 liters per month. And out of that, about 12,000 liters are coming from the viral load and EID platforms alone. And that means those platforms or those liquid coming from there are generating GTC content in them. And of course, when you look at the material safety data sheet from the molecular testing, it does indicate that GTC actually is found in these reagents. And of course, that means the waste that they are being released in the environment contain GTC. And just to give you a furthermore illustration of the magnitude of the burden that I'm talking about, if you translate 12,000 liters into drums, that is equivalent to about 120 drums. And of course, this is a huge problem. And what the ministry was doing at the central lab is that every 2 weeks, they have a contract with an external provider that do this collection every 2 weeks at a cost of $2,000. And of course, in terms of budget, that is not cheap. And also, in addition to that, the service provider disposes this waste, the liquid waste, to a military facility. And to make the matters further worse, the military facility is a restricted area. So it's not possible for the civilians or the ordinary population to access and determine accurately how these waste are disposed. So it is not very clear to the ministry basically how the final disposal is done. And of course, such a volume that we are talking about, you can't just ignore. You have to come up with a think through outside the box to address the challenge. And the picture on the right shows you a position of the underground chamber, which is about 42,000 liters, which when it's not collected within the required period, it pops up, it starts leaking, and you see how it has eaten the environment. And of course, that shows that it contains hazards. So because of those issues, there was a quest to have control of the final disposal and also to handle the issue to do with the cost that is sustainable. And it really prompted the ministry and with support from partners to see how best we can address the problem. So the objective of the new intervention was to destroy cyanide in the liquid waste that is generated from this testing, I mean viral load and EID testing, and also to gain control of the final disposal. As I mentioned earlier, that these were taken to a military facility which is not easily accessible, and also to cut down the cost. Those were the main three objectives that really was driving the efforts towards coming with a new intervention. And of course, the quantity of liquid generated, which is when you bring it down to per day, is around 400 liters, is a risk actually to the environment. And when this was characterized further, it was confirming that there was presence of cyanide in that waste that is coming out of the lab. And this analysis was done in a lab in South Africa called SetPoint, which is an accredited lab for environmental analysis. And results from that lab showed us that indeed the liquid waste contains cyanide in the range of 400 to 700 milligrams per liter. And of course, that is way above the national standard for National Environmental Authority, which is the authority that oversees environmental issues in Uganda, of 0.1 milligrams per liter. And in addition, it is showed that there are some other chemicals or materials that are found in the lab, in that waste, liquid waste, such as chromium, selenium, manganese, and the rest of it. And in the right, that is the report that came up from the set point. And you can see that under that there is the sample that we have put in this presentation as about 701 milligrams, of course, which is very high. So with that, with those all issues, we had to think through, and we had to go into literature review to be able to find out what other solutions were there. And of course, those 5 solutions or intervention areas came into our mind. One was the ozonation using UV. The second one was hydrogen peroxide using UV. And others that we found out were incineration method, plasma act, bioremediation. And in first thinking through, as a country, we started trying off with the ozonation method. But later on along the way, we realized it is a bit complex and complicated, especially when it comes to ozone generation. And that requires more other items like air compressors, filters, and also a need for construction of lagoons. And if you can see the picture on the diagram on the right, up is the picture of the ozone machine, which is also very cheap, very expensive. And down is the lagoons that we require for the treatment, which you are over 5 of them. And of course, management alone and the initial investment was huge. And that prompted us to zero down on the second method, which is the hydrogen peroxide and UV approach. And in that method, we realized it was, sorry. There's some interruption. Somebody trying to talk?
Sorry, Joel, we will get over that shortly. Thank you.
Okay, thank
Continue.
you. So the second method that we zeroed on and what we are working on right now is the hydrogen peroxide UV light method, which was selected as a method of choice. And this one requires, the setup is less elaborate or complex compared to ozonation method. And also it can accommodate a very small space. And on the right, you can see the actual equipment that we use in the hydrogen peroxide UV approach. It is the machine that is called the N-Violet. Also, sometimes you can call it the LabCoP machine, which is just a small machine and contains some elements that supports generation of UV light in the presence of hydrogen peroxide, and the reaction can occur that will give a byproduct that is less toxic and is friendly to the environment. So the key elements basically are 4. Of course, the strategy in that is that the breakdown of the nitrile bonds in the cyanide is done. And this bond, which is really a very central bond in the cyanide toxicity and resilient in the GTC. And if that bond is broken, the byproduct that is coming out of the reaction is friendly to the environment and does not cause any harm to the environment. And this has been proved based on what you will see in the next few slides. The requirement of the setup, you need the machine, which is called a LabCoP, plus its accessories. You need the cyanide test kits. You need the pH meter. You need the temperature meter. You need the hydrogen peroxide and the fume wood. And basically those are all. You don't really require so much as compared to the first method that we initially tried. So the procedure is that the GTC waste, which is in liquid that comes from the lab, is treated with the hydrogen peroxide in the presence of UV light at an ambient temperature and pH for a period of about 1 to 2 hours. We have said about the ambient temperature and pH deliberately. If you need more information, you can contact us, but that's not part of this discussion. But that is what is the reaction, the procedure that takes place. The process is performed under a fume wood to exhaust any hazardous emission that may come and may be released without your knowledge to the environment. And of course, what we found out at the end shows that cyanide was degraded to undetectable level after this reaction has taken place. And of course, the outcome that we got, for example, after retesting what has been neutralized in this machine, the volumes that are coming out contain cyanide that are in lesser than 0.02 milligrams per liter, way below what is required by Uganda national standard of 0.1 milligrams per liter. And that is an illustration of the reaction that takes place. Liquid waste containing GTC reacts in the presence of hydrogen peroxide to produce carbon dioxide and oxide of nitrogen. And this product is safe to the environment. And of course, you know, carbon dioxide is absorbed in the atmosphere and also used by plants and the rest of it. And really, it was showing us that whatever is coming out is friendly. What you are seeing in the slide is the national standard on the left. You see the time that that sample was taken, where there's a green arrow. The amount of cyanide was 368, way above the standard of 0.1 milligram. And on the right, where the arrow is showing, the certificate of analysis after the reaction has taken place or after the degradation has been done. It is you can see it is very tiny, but it is 0.07 milligrams, which is below actually the required the standard for Uganda in terms of environmental authority. So it has proved to us that this method works very well. And to be sure that the product that we are releasing out to the environment not in any way have additional undetectable level of certain substances that we might not be knowing or other intoxicant. We subjected those byproducts into test again for that testing, and that is the results. The results, the scores actually show that, the scores were lower than the minimum value score of 850, indicating that the above functioning group or we were all match what we are expecting. So the byproduct that are released out of the reaction actually never indicated any harm, and that is a proof to us that this method effectively and very well degrades the cyanide that is produced due to viral load and EID testing. Basically, that is what we have, and I want to acknowledge National Health Laboratory Diagnostics and Diagnostic Services, Minister of Health, Uganda. I want to acknowledge PETFA, CDC, Uganda, and headquarters, Paribias Investment, which is the firm that is helping us with this, and the Setpoint Lab in South Africa that has been doing this testing, the Makerere University that has been helping us in generating this literature review, and the Government Analytical Lab in Kampala. And thank you very much for listening. I welcome questions. Thank you very much. Over to you, Francis.
Thank you. Thank you very much, Joel. A very elaborate presentation there. Clearly getting us through the rationale for the work that we've done in Uganda, and of course the details of what happens with GTC when we take this approach to degrading the cyanide in the waste that we are producing, and of course huge amount of wastes that are being produced from the centralized viral load and EID testing facility in Uganda. Let me now take us to the next presentation, and that's going to come in from Kingston. Kingston, I know that Fitsam is going to help you share the slides, and Fitsam, kindly put the slides up.
Thank you very much, Francis, and thank you, Fitson. Good afternoon, good morning, good evening, depending on where you are. We'll be presenting on the work we did on centralized waste management, liquid waste management. Permits me to close my video so that we'll reduce the bandwidth. I just wanted you to at least have a view. So Fitson, next slide, please. Yeah, so what we are presenting today was one of the abstracts that we presented at the ASLM conference in Cape Town in 2023. So I just wanted you to have an idea, and you can also read about it on the when you have access to the conference materials. Next slide, please. So as a form of background, according to the World Bank, the global waste may reach about 3.4 billion tons in 2050. And this is with a 70% increase from what the levels we had in 2016. And HIV viral load testing and, of course, EID testing contributes to these 3.4 billion tons of waste that we currently are generating. And Nigeria is also carrying out HIV testing. We actually conducted over 6 million viral load tests across the 17 laboratories we support in Nigeria from 2021 till date. Next slide, please. Now, as has already been said, the liquid waste generated from HIV viral load and EID testing contains GTC, which is an RNA isolation and protein solubilization agent, which is toxic, of course, to humans, animals, and the environment if not properly treated. And most countries are having challenges, managing their waste, including liquid waste. And there are some of them that even pour the liquid waste down the drain. And Nigeria was not different until 2021 when we carried out this pilot that we are presenting now. Next slide, please. So, talking about centralized liquid waste management, for GTC to be properly and effectively treated, it requires a high capacity rotary kiln incinerator. But of course, that is quite expensive to procure and maintain. And we also noticed that incinerators are not energy efficient, especially when it is treating high water content. And so the fuel that is used now to burn the materials in an incinerator also contributes to greenhouse gas emission. And that is contributing to the waste or global climate change that we're experiencing. Next slide. So again, there are several methods for waste management, or especially liquid waste management. You have the activated charcoal method, burning using cement factory, and of course you could also do centralized one, waste management, which is the subject of our discussion. But each of them have their own merits and they also have demerits. But when you talk about centralized waste management, it means moving the waste from where they are generated to a central location for them to be treated. And when you have a centrally located waste management plant, it reduces its cost of setting up several incinerators. For instance, I just mentioned there are 17 PCR labs in Nigeria that are testing viral load and EID. If you are going to set up incinerator in those places, you are going to be incurring so much cost to do that. Other than setting up, you also incur a lot of waste to maintain these incinerators, and it's not cheap maintaining them. Then, of course, you require a lot of provision of power supply. Incinerators consume a lot of power supply, and that is an additional cost to the government and, of course, funders. And you also require human resources to operate each of these incinerators. So that is why we went for a centralized system, so that we can efficiently and safely handle the waste that are generated in laboratories supported by USAID in Nigeria. With a view to meeting USAID environmental regulations, the local laws in Nigeria, and of course, international best practices. And these are the three laboratories where we carried out this study between March 2021 and November 2022. The Nigerian Institute of Medical Research is somewhere in Lagos State, south of Nigeria. The University of Uyo Teaching Hospital, which is in Uyo, Akwa Ibom State. Then we have the Chukwuemeka Odumegwu University Teaching Hospital, which is somewhere in Oka, Anambra State, south of Nigeria. Next slide, please. So what were the processes? How did you go about implementing this centralized method of waste management? First, we carried out laboratory and waste disposal facilities assessment. That helped us to estimate the laboratory operational capacity, the volume of waste generated by each of these labs, and per time, and determine the number of tanks or storage tanks that will be required by each of the laboratories. After the assessment, we also assessed waste disposal plants that were available, in those facilities, and of course by private sector operators in the country. Based on the findings of the assessment, we developed an action plan to implement waste management so that we could stop the facilities from pouring the waste down the drain, like we had mentioned earlier on. Following the development of the plan, we started with an advocacy and sensitization meetings with management of the laboratories for their buy-in so that they will accept for us to implement this as part of waste management. And of course, we conducted training for laboratory staff and waste handlers in each of those laboratories. Next slide. Next, we developed and deployed tools that are being used for the documentation and reporting of waste generated by each of those laboratories to guide full implementation so that we know when they are getting the tanks we are deploying, we should be able to know when they are getting filled, and also for us to track over time how the waste are being generated, and of course for better budgeting next time. Then we engaged waste management vendor, looking at the issues with public waste management or incinerators. We had to engage a private vendor that has been in the system, that is also involved in the management of solid waste that are generated across all the facilities in the 36 states plus Abuja of Nigeria. After the engagement of the waste management vendors, we now deployed the tanks for the storage of these liquids and connected them with the necessary accessories for liquid collection from each of those testing laboratories. That is the 3 testing laboratories. And to prevent unauthorized access to where these tanks were kept, we provided biohazard tapes to cordon off the area from unauthorized persons. Next, implementation started, and we followed up regularly to be sure that things are working. So through periodic visits to the lab for physical checks of the tanks and pipes to ensure that no spillage or overfilling. And that led to timely retrieval of the tanks before they get to a critical level, which is usually about 3/4 full. When these tanks are retrieved, they are moved to the vendor, who is in Port Harcourt in south of Nigeria. So for the study period or the pilot period, they were moved in a cycle of three cycles over a period of 5 months, using specialized trucks that are marked with conspicuous biohazard signages. And when they get to the disposal plants, they were disposed with special purpose incinerator at a temperature of between 1,000 and 1,200 degrees Celsius. And using this ensured that all active components in the liquid waste were destroyed and that no residue comes out from the process that is harmful to the environment. Next slide, please. So what you are seeing now are these tanks that were installed in 2 laboratories, the University of Uyo Teaching Hospital and the Chukwuemeka Odumegwu University Teaching Hospital in Oka. And they were directly connected to the laboratory so that the waste could be disposed of straight into the tanks. Next slide. So when the tanks are full, the wastes are evacuated by the private sector waste manager that was engaged for that purpose. So this is a picture of when waste were being moved from the laboratories to the waste plant. Next slide. When the waste gets to the disposal point, they are discharged into the plant, the disposal plant of Boskel Nigeria Limited. So at this point now, they are being loaded into the disposal plant. Next slide, please. So the treatment process is also here, how they are treated. Because of lack of time, we will not look at it, but you could read it by the time you get this slide. But fixing, you could click on the video so that you see the temperature and the how the incinerator works. So this is how the burning is done. It's a rotary kiln incinerator, like I said, and that ensures that the liquid and all the content is well rotated and burnt off by the plant. Next slide, please. Now, after disposal, after being burnt by the incinerator, we wanted to be sure that whatever air is released into the atmosphere and whatever water is coming out from the process is also free of anything that could be injurious to human, animal, and the environment. So testing is conducted, flue gas is collected from the incinerator and tested. So to your left is the outcome of test, one of the tests conducted from using the flue gas that was released after burning the liquid. Then to your right is the water, the effluent, effluent water that was tested post treatment of the liquid waste. And if you look at these results, they are way less than the national requirement or the standard determined by the Environmental Management Agency of Nigeria. Next slide, please. Now, this table shows how the waste were generated by each of the laboratories. So the NIMA laboratory that is in Lagos has two Roche Cobas equipment, the 68 and 8800 high throughput equipment. And there are two of them. And the total number of viral load tests conducted that period was 242,000. And of course, the number of tanks that were installed for that facility were 4. But they were moved in 3 cycles. And within that period, they had about 4,300 liters of liquid waste. And same thing, but for Cohort and UUTH, as at the time of the pilot, they had the Abbott M2000, but those have now been replaced with Alinity M, and will still continue. And they had a total of 3 cycle movements. So in all, about 19,500 liters of waste was generated during that period from testing of 725,388 clients. Next slide. So what are the major lessons that we learned from the pilots of the centralized liquid waste management? One, during the study period, we learned that the collection, the transportation, and disposal did not encounter any problems. And also because we had taken care of all the necessary, putting all the necessary storage, ensuring that the transportation was properly done following standard, international standard, but also there were permits that were gotten from the regulatory agencies and authorities so that there was no issue transporting it from where they are to where they were to be disposed of. However, just to say that following the scale up or continuation of the centralized system of liquid waste management, one of the laboratories was renovated. As part of the renovation, the tanks were relocated, and where they were had, they were under the sun, and so we noticed, release of gases that affected the trees around that, and that has also been addressed. But during the pilot, we didn't have anything like that because they were all protected from the sun and all that. The another lesson we learned from this implementation was that the plastic holding container are made from high density polyethylene plastic, and they are encased in a metal exoskeleton. And this helps to mitigate the risk of breaking in case those tanks fell off during transportation and all that, even though we didn't have any case of the tank falling. So the use of high density material was also very advantageous. Also, from the measures above, that is 1 and 2, those ones ensure that there was no negative environmental impact because of transporting them from the 3 PCR lab to a central facility in Port Harcourt for treatment. So we covered all the grants, and like I said, we also have permits from all the necessary regulatory bodies and agencies. Also, the overall waste treatment was handled currently and in compliance with local and international safety and regulations requirement standards. Like I said, to be sure that we are doing the right thing, we make sure that during the burning, we also have somebody who is there from a partner to ensure that they are following the standard, and flue gas was also collected, and of course the endpoint water was also collected for testing. Another very important lesson from the pilot that was conducted was, of course, cost-benefit analysis that was conducted. We discovered that it cost about $3.23 to dispose of a kilogram of liquid waste, compared to an average cost of about $5.28 to dispose of hazardous waste, which shows that it is cheaper to actually use this method that we have adopted. Next slide. So after the pilot, we have, next slide, just click on the button. We have also now scaled it up to additional PCR laboratory to make it 4. We did the pilot in 3, but we have added 1 now. Then between when we started this implementation or pilot till now, about 36,630 liters of liquid waste have been moved and disposed of in 6 cycles. So during the pilot, we had 3 cycles of movement. Last year, 2023, we have 2 cycles of movement. And so far, as I've made this year, only 1 cycle of movement has been done. Now, with the success that we recorded with the centralized PCR lab for viral load and EID, and following the implementation of GeneXpert EID testing in several facilities across Nigeria, we have also now covered the disposal of the used cartridges from GeneXpert sites in the country, because the GeneXpert cartridges also contain GTC components. Next slide. So what are our recommendations? There are basically 2. That centralized molecular waste management and disposal is a safer, scalable, and sustainable alternative for the management of PCR laboratory liquid waste. And it is sustainable because with the cost, from the cost-benefit analysis, is something that we feel that can be transitioned to government with time for continuous implementation and disposal of the liquid waste. So we're also recommending the integration of more PCR laboratories in the country into the existing arrangement to reduce cost of waste management. Next slide. So I'd just like to acknowledge the following organizations, companies, and government agencies, and of course the private sector managed incinerator in Port Harcourt, Bosque Nigeria Limited. And of course also the management and staff of the 3 supported PCR laboratories. Next slide. So I've just put the references here for further reading by the time you get this slide. Thank you very much for the opportunity.
Thank you. Thank you very much, Kingston, for that very clear and graphic presentation on how we're handling the centralized disposing of liquid waste through a centralized incineration system in Nigeria, and how these things are moving from lower facilities, other facilities, to the centralized disposal unit. We have quite a number of questions coming through, and I will ask that you also be dealing with some of those questions in the chat as we deal with others verbatim in our presentation. And I'll let you take a breather, and I will start with Joel. And Joel, there are quite a number of questions. I'll take the first, and the first relates to your guidance. Would you guide smaller laboratories to actually take up this method, or this method is more recommended for high throughput laboratories or a centralized disposal unit per se? What's your guide?
Thank you very much, Francis, and thank you, the person who asked the question. Just before I answer the question, we are here with the engineer Mutaka, who I've been working with in this, and scientist Joseph Mugoye, and we shall be contributing, all of us. But going back to the question, yes, the method that we just presented is basically for high throughput laboratory. If you notice, the sample transport network system that we have, all the viral testing are centrally done in one reference facility, apart from a few insulated regions which are basically having POC. But for plasma, it is all over the country, and of course that tells you the magnitude of the liquid waste generated and how high level this lab is. So I would recommend that this is not possible for small labs, but for high-end laboratories. Thank you.
Thank you. Thank you very much, Joel and team. And a quick one again, still with you and the team. Please do confirm that this unit that we are actually using only works for conventional platforms, waste that are coming from conventional platforms, not those that are coming from a point of care testing. Because there is a question from Roseanne, and she's asking how you're getting the liquid waste from cartridges and feeding them into your treatment tanks and plants.
Thank you, Francis, and thank you, the person who asked the question again. Yes, this is for conventional platforms. For POCs, we have a few sites that are conducting viral testing specifically for pregnant women, pregnant and breastfeeding women and adolescents. And those one has a different management system. There's a provider that is collecting waste, a company called Green Label, that picks those waste from the regions wherever they are and take it to a high throughput, high capacity, high temperature incinerator somewhere else. But this is, yes, only for conventional system.
And finally, before I leave you and the team, there is a question that relates to the fact that this treatment seems to be more focused on GTC, but we do know that the liquid waste that is coming from these conventional platforms do have probably biological hazards as well as chemical hazards other than GTC. And so subsequent to your treatment, and when you're sure that GTC is eroded, do you do some additional treatment for any other chemical that might be there or the biological agents that are there before final disposal?
Thank you, Francis. Can I give my colleague also opportunity to say something?
Please
Engineer
do.
Mutaka or Joseph, come in, please. Thank you.
You guys are not using the same device, and so we will give my team in the background a second to identify them and give them rights to unmute. But you could deal with this partially as we look for Mutaka and Joseph.
Thank you. So yes, from the reaction from the last slide that we had, you saw the result that that were projected in the slide for the analysis that was done for other aspect of the byproduct. That was actually showing a score of less than 850, and that actually did indicate that part of the process actually do deal with this. But to mention, our main interest was majorly on GTC, but the other aspect of the mineral, for example, the chromium, the titanium, and some of the byproducts that were part of that. Of course, that involved money to analyze all those other byproducts, increasing the cost. But since our focus was basically on GTC, we majorly focused on GTC, as much as a few of those were analyzed, especially on the last byproduct that was done, which actually showed the ranges were acceptable. But I wanted to give our scientists, if they have muted, Joseph, if you're there, just to say just a few words.
Joseph, you will add to this just momentarily. And your second name, please let us know. Joseph, you can put up your hand and we'll give you the rights to unmute. Let me get to Kingston as we get sorted with that. And Kingston, a very impressive presentation, but a quick question on, you're using the plastic tanks and of course with the exoskeleton, and you've never got any experience of anything dropping and spilling. But even when we are very cautious now, the expectation is that running it 10, 15 years down the line, there could be one day an accident that may get one or two tanks dropping off. So did you ever do a drop testing to just be sure that if it ever dropped, nothing would spill?
Yeah, we have not done that following the implementation of this liquid waste management, but that is using the waste. But at the disposal plant, they have done that and confirmed that yes, it won't break because there's an exoskeleton of metal that is that enclosed the plastic component. So they've tried it with water, not the liquid waste, and they didn't have any issue. But we'll continue trying it because as we continue to expose the plastic, we want to be sure that it's not degrading and affecting the texture and all that. Thank you.
Thank you very much. And there was a question from Ed related to your cost-benefit analysis. And he just wanted to be sure what cost elements you included in your costing. I do not know if you have some quick highlights on the cost that you're sharing. What were the elements that were driving the values and the figures you're sharing out here?
Yes, so the figure we have shared is for the pilot, and it covers the cost of setting up, procuring the materials required, setting them up, moving it to the factory, and disposal. So everything was costed, and it gives us $3.28 to burn. We know that cost will reduce as time goes on because we don't need to be setting up again. So that cost will definitely should have come down. But I don't have the correct cost, but this is just the cost for the pilot. Does that answer your question?
Yes, it does. And there is an interesting question coming in from Susan. And Susan is actually asking, as we struggle to do the movements of this liquid waste back and forth, and of course, not forgetting that you guys are dealing with the cartridges separately. Are you in touch with the manufacturers to see if they can also step in to support the safe disposal of this liquid waste, or it's just for now you and the team that's dealing with this?
Okay, confirm you are referring to the GeneXpert site, or is it the centralized laboratory?
The general liquid waste, not GeneXpert for now, but generally speaking, are we in touch with manufacturers, especially the conventional platforms with those huge amount of liquids? Are we in touch with manufacturers to make sure that they can then also provide additional guidance on how we can be dealing with this waste?
Yes, we have been in talks with them, discussed how they can support, and of course, even looking beyond, the disposal, but using materials that do not contain GTC, because we have also seen a particular vendor that is not using GTC materials. So the waste disposal is far better than the other two equipment manufacturers. So we've been in touch, and I'm also sure that their research and development units will be working on that. But again, it's not something that can be handled by one country alone. And I recall that ASLM had, brought up that discussion. I mean, that point at the time to engage with the manufacturers, to look for better means. I mean, of RNA, protein solubilization and all that. So it's something I think we should throw back to the ASLM and, of course, other international partners, even as we also engage them at our own level. But we're hoping that a solution will be found in no distant time. Thank you.
Thank you. Thank you very much. Let me get back to Joel a little, and quite a number of questions coming and very interesting, but we will deal with all these questions even post the session today. But the one that is there is from Ed, and Ed is again asking, Joel and team, we have multiple research labs in the country that are also doing viral load testing. And so do you have a way of supporting some of these labs or providing them guidance on how to use this very effective method you're using to degrade their GTC so that their disposal is also as safe as the one that is happening at the centralized viral load and EID testing labs?
Thank you very much for that question. So what is happening is that the current lab that is being supported in this effort is the Ministry of Health lab that tests all the samples coming out throughout the countryside to a centralized point. And those other research labs basically are not directly focusing on the patient or the kind of patient that we are targeting, because this is a national program that is being supported by PEPFAR, and we're looking at the HIV related labs that are supporting the national program in the efforts of supporting care and treatment services. So these other labs, yes, they do exist. We have a backup lab for viral load just in case there's a breakdown in the centralized testing at Central Public Health Laboratory, but that only happens when this lab is not functional and is in a very small volume. So the focus is still on the one public health lab, which is for the ministry, and this is work in progress. After we have established the system and it's working functional properly, we can probably consider now these other research labs that are not probably maybe doing work for public health as at the moment.
Thank you. Thank you very much, Joel and team and colleagues. Thank you again for being part of this very exciting session. I don't know if Joseph is now available, or Mutaka, Engineer Mutaka, to deal with the question related to the other agents in the waste material, especially the biological agents. Are we taking care of them before we do the final disposal of our GTC-free waste into the environment?
Yes, thank you so much, Francis. I'm here with Joseph. Let Joseph throw more light onto that. Thank you so much. Joseph.
Francis, I thank you for this opportunity. Now, briefly, I should say that in our analysis, situation analysis, the biggest challenge was GTC. And how did we come about with that? After that analysis, which we carried out in South Africa, we realized that all the other potentially difficult areas or recalcitrant materials were within acceptable ranges to be discharged into a lagoon, which we already had on site. If you took an example of any other that you may think of, let us look at what we call the oxidation potential for the hydroxyl iron, which is the main species that we rely on to degrade the materials in the LabClean equipment. That oxidation potential is 2.8 volts. And that's just only second to fluoride. That means that it is very, very unlikely, and I would use the word unlikely because we haven't done a test, that we can have any materials, biological materials surviving after that. It's very, very unlikely because even the guanidine thiocyanate doesn't survive that oxidation. So that is the confidence we have. But quite realistically, when you raise that question, we shall go back and maybe do some tests to see whether the any survivors that may need to be dealt with separately, but it's something that is very highly unlikely. And maybe to add to that, we also expected, as you mentioned, that there could have been other intoxicants. Yeah, it's possible when you do an oxidation reaction, yes, you can actually create more difficult intoxicants. But with our current tests that we did with FTIR, which was done with one of our home-based laboratories or government analytical laboratories, there were no recalcitrant materials that emerged after our advanced oxidation process. I thank you very much, Francis.
Thank you. Thank you very much, Joseph, for those, again, very insightful responses related to anything, because we cannot take chances when it comes to degrading the environment. And colleagues, we have still additional questions that we will be compiling and sharing with our presenters today. There are those that relate to the cost. There are actually those that relate to the setup and also the safety of the UV light that is used in the as part of the degradation of GTC. Is it open? Is it hidden somewhere so that the people who are operating and feeding in the waste materials are not getting exposed? But all those and others will be dealt with, and then we'll share with you the responses as part of the materials that will be coming your way. Do not forget that when it comes to GTC containing waste, I have just double checked with the MSDS, and the first caution when it comes to waste management is that do not ever pour it down the drain. And so for colleagues, countries that are still doing that, know that you're doing a lot of harm to the environment. Do not pour a GTC containing waste down the drain. There are multiple options to deal with this, and we have seen some of the options here, and we'll continue getting to you to deal with additional options that may be there, and you will have to choose whichever one relates and applies to your context. Again, thank you so much for joining, and until we meet again from us, ASLM and partners, we wish you the best of your day, afternoon, and evening, given the location where you're joining us from.